Hi, everyone, and a warm welcome to another episode of the Talkroom series of podcasts. I'm Ian, and today we're diving into an incredibly important topic, mental health and well-being, specifically focusing on trauma. Our goal is to explore how you can be your best self, even when faced with the challenges of this condition, by leveraging the power of counselling and the therapeutic support. For those people who have yet to see any of our previous podcasts, I'd like to introduce my co-presenter, Wendy, who is a highly experienced CBT psychotherapist and EMDR therapist. She's been involved in the field of mental health and well-being for well over 30 years now. We're both passionate about helping people to navigate their mental health, and today's discussion is a crucial part of that.
Thank you so much, Ian. And for those who are joining us for the very first time, I would like to introduce my co-presenter, Ian. Ian is a senior accredited National Counselling and Psychotherapy Society member and the founder of Hope Therapy and Counselling Services. Hope is a counselling organisation offering support throughout the entire UK for a wide range of presentations, including the topic we're discussing today.
And I understand today you are talking about the really important subject of trauma. So can we start by just saying a little bit about what you mean about that word trauma?
Yes, thank you, Ian, and a very good question to start. So, trauma can be broadly defined as an emotional response to an event or a series of events that are really overwhelming or distressing, significantly affecting an individual's ability to cope. Trauma can result from an enormous and wide range of experiences, including physical, emotional, or sexual abuse, accidents, natural disasters, or even witnessing violence. And there are several categories of trauma symptoms, and it can help to know and understand the differences between these categories. And these categories are used to diagnose people who've had a cluster of symptoms, and it can also help to provide appropriate treatment depending on the symptoms you're experiencing. It's really important to note that if an individual does not meet a certain criteria for a mental health diagnosis regarding trauma, it doesn't mean that they aren't suffering from trauma. It just simply means they don't meet a specific diagnosis.
Thank you, Wendy. That's really helpful. And do you want to just give us the broad categories that you mentioned that identify trauma using the range of diagnosis that's actually available?
Yes, certainly, Ian. So just a sort of broad brush scope on the diagnosis. So the first one is called acute stress reaction. And this is defined as a response to a single traumatic event containing one or more of the following reactions. So fear, anxiety, panic, agitation, anger, and despair. So, in addition, it's quite common to experience physical symptoms from trauma, such as the whole body shaking, a rapid heart rate, and often nausea feelings as well, which are most unpleasant. So, with acute stress reaction, these symptoms would normally last about 2 to 4 weeks after the initial traumatic event. And they're seen as normal reactions to understand, a reaction to an adverse event. And then the next one, which probably most people have heard about, is called PTSD, which is short for post-traumatic stress disorder. And this diagnosis focuses on a distinct set of symptoms that also arise from exposure to a traumatic event. And it can involve experiencing the event or witnessing an actual event. So it can be actual or threatened death, serious injury, sexual violence is another example. And The best way to describe PTSD is it tends to be a reaction to one single traumatic event, or maybe a number of one or two, but it tends to be more of a single reaction. And the actual categories tend to fall into three broad areas. So the first one is intrusions. So this is where the traumatic experience that the person has had, it's not just simply remembered, they actually feel that they're reliving the trauma as if it was still happening. And these can include, visualizing very intense images, or suffering from nightmares, or actual flashbacks to the actual events, where again they feel as though they're in it again. They're actually reliving the experience. So it's much stronger than just an image. The second category is called avoidance, and this is where, understandably, individuals avoid or push away all these distressing symptoms. And there's all the kind of avoidance about not wanting to talk about it in therapy, or not wanting to talk about it with your friends or family members, and therefore the distressing symptoms don't get processed. But there's other forms of avoidance, such as emotional eating is one, or forms of substance misuse, or even other forms of addiction, such as even over exercising. Other kind of reactions of avoidance can be overworking or oversleeping, or a common one now is mobile phone addiction. And then the third set of symptoms are called hypervigilance. And this is where the person feels they must remain on guard at all times to address potential threats. So here they often experience a strong sense of a real physical arousal in their body, the symptoms that we described earlier, like the shaking and the heart beating, everything like that. And also when they behave as though they are always on guard. So, for example, if they went to a restaurant, they felt they had to sit with their back to a wall and observe everybody in the public space, just in case there was some kind of potential threat. And then the third area is called complex PTSD, sometimes shortened to C-PTSD. This is another sort of set of symptoms. So a very common one is called emotional dysregulation. This is where the individual feels it's very difficult to control their emotions, including intense feelings of sadness or anger, or they may be suffering explosive outbursts that they can't control. And again, people might have persistent feelings of just feeling emotionally overwhelmed, or actually nothing at all, just a feeling of numbness. Often a person's sense of self can become negative. So examples are having strong feelings of not feeling worthy, or feeling shame, guilt, or a sense of failure. People who have complex PTSD may feel fundamentally broken or incapable of just absolute normal functioning on a day-to-day basis. Often people with complex PTSD have interpersonal problems, so difficulty trusting others, or difficulty maintaining relationships or feeling connected to other people. People with complex PTSD often withdraw socially, or the other extreme, form unhealthy, dependent relationships, which obviously makes all the symptoms much worse. There's something called dissociation, and there's different types of dissociation. This is where you actually sort of feel as though you're out of touch with reality. So one of them is called depersonalization, and this is where you don't sort of feel connected with yourself. You sort of feel out of your own body. Or the other one is called derealization, is that you feel the world around you is not real. It's almost as though you're in a different place. And that can be very distressing. And if you don't understand the symptoms, actually very difficult to deal with. So if you have complex PTSD, you often have other problems such as depression, which is obviously a sense of low mood, or dysthymia, which is a sense of feeling of hopelessness. Just, it's not really worth it. What's the point? There's no point in carrying on, are very sort of common feelings. You can also have anxiety disorders, general anxiety. It's very common to have panic attacks or social anxiety, which is where you develop a fear of going out and being with people. You can have dissociation disorders, such as feeling as though you've got multiple personalities. Another common one is borderline personality disorder, and this is where you have unstable moods, you have poor self-image and relationships. In that, you can develop that. And obviously, you can develop more substance use disorders, coping through drugs, alcohol, other addictions, or somatic symptoms disorder. This is where you have chronic physical complaints or health anxiety without a medical cause. So it can actually sort of go into your body. You can really sort of feel the symptoms or feel a real deep sense of pain, or just, your body's not well, or you sort of feel unwell in that situation. So as you can see, it goes from quite simple symptoms to actually very, very complex symptoms with the complex PTSD.
A really wide range of symptoms, and I'm almost wondering if it feels like like an overwhelming list.
Yes, I agree with you, Ian. It is a really broad list. But what I'm hoping is, if people have a description of the different types of trauma, they can better understand their problems, and perhaps notice that the reason why they have an addiction or they're depressed, it's a reaction to a traumatic response, which simply is not their fault. And the better they understand the trauma, the more likely they're going to feel better and feel more in control.
And once you've understood your symptoms and maybe thought about incidents that may have caused the trauma, what comes next? What can you do?
Again, a very good question, Ian. And there's an awful lot of research on a whole range of activities or therapies you can try, but I've just actually taken one called the window of tolerance. And what's really good about this, it can really help you to feel a sense of control over your symptoms. So it's something that people can do as a self-help process to help them feel more in control in their daily life.
Okay, so the window of tolerance, and can you say a little bit about that? Can you describe it?
Yes, certainly. So the window of tolerance, it's a concept in trauma therapy that helps individuals to understand and regulate their responses to common stress and emotions, to really focus on engaging with the present moment without feeling overwhelmed or shut down. And the actual terminology was developed by a man called Dr. Dan Siegel, who is a clinical professor of psychiatry. So if you actually start to get good at developing your window of tolerance, the benefits will be is that the individual should be able to think more clearly, better regulate their emotions, and respond flexibly to stress. So it can help all three categories, the window of tolerance, depending on what level of trauma you're at. And it's also important, actually, it can help people to feel connected to themselves and others. So the problem is that trauma can narrow a person's window of tolerance, make it much more easily for that person to feel dysregulated, to feel that their emotions are out of control and they feel overwhelmed. And if you feel overwhelmed, you can go into one of these two extreme states. So the first one is called hyper arousal, and this most people know as a fight or flight mode. So this is when you don't meet your window of tolerance, you're out of your window of tolerance, and you feel a great stress response. Your stress response is heightened. You probably feel overwhelming experiences of anxiety, anger, panic, or that hypervigilance that we spoke about early. So if you're in fight or flight, you're more likely to have really racing thoughts, more likely to feel irritable or aggressive. And again, the physical symptoms such as rapid heartbeat or shallow breathing. So that's hyperarousal. And the next one is hypoarousal. And this is like the freeze mode. And a lot of people with trauma describe this sort of like feeling frozen and stuck to the floor. And this is when a person becomes just emotionally numbed or shut down. And here, this is where they may experience what we talked about before, like dissociation, sort of feeling out of yourself, feeling out of your body, or shut down, like feeling depressed, or just no feelings at all, such as emotional numbness, or again, that disassociation, just not feeling connected to reality and other people. So classic symptoms when you've got hypoarousal, the freeze mode, is feeling emotionally detached or numb, or fatigue or exhaustion, or really difficulty actually concentrating or thinking clearly. So trauma survivors, particularly those who've got more than one traumas, complex trauma, often struggle with maintaining this balance when the window of tolerance becomes overwhelmed, because their nervous system has been conditioned to respond intensely to stress. So the trauma triggers push them into either the fight or flight or the freeze more easily. Hopefully that makes sense.
Yeah, I think so. So the window of tolerance is a way of understanding your reactions to triggers that remind you of your trauma.
Yes, that's right. Well done, Ian. That's absolutely
Oh,
correct.
wonderful.
And the aim of the talk today is to explain how an individual who's had trauma expands their window of tolerance to help to reduce your unhelpful reactions to triggers. So here are some key skills. And again, these are pretty self-help skills that I thought might be useful. So the first one that most people might have heard of before, but it's called mindfulness and grounding techniques. So mindfulness is a very, very key skill now in therapy, and it involves just staying present and aware of what you're thinking, feeling, and any physical sensations without negatively judging them. This really helps. So when you notice you become dysregulated and feel overwhelmed, you just say, okay, I just know what's going on now. There are thoughts and feelings, but I'm going to go back and focus on something in the present moment. So that's one technique. Another technique is called grounding exercises. And this is where you can actually just focus on something to sort of bring you back into the feeling of being in the present moment or feeling back in your body. So you can focus on your breath, just noticing your breath going in and out, or just feeling the sensation of your feet on the ground, something very simple like that, but just noticing your feet on the ground or yourself sitting on the chair. Another one that you might have heard of is simply naming 5 things that you can see. And this really helps you to go back into the reality of stopping feeling triggered or disassociating. And there's also meditation you can do called the body scan. And this is where you bring attention to different parts of your body to release tension and just to increase awareness of your physical state. And I'll come back to that a little bit later. And then the next thing you can do is breathing exercises. And most people have heard about breathing exercises, but it's just important just to sort of go through a few techniques. So often it's called deep breathing or diaphragmatic breathing. And this is a really powerful way to calm these feelings of overwhelm, stress and overwhelm. So all you need to do really is just slowly inhale, say for at least a count of 4, and just hold your breath gently for maybe a count of 4. And then just exhaling very, very slowly, a little bit more than 4. And this can actually activate the parasympathetic nervous system. And sometimes it can actually help to count as well, because you're focusing on the here and now by counting. And also breathing from your stomach, not from your top of your chest, focusing on breathing more from your stomach, and just gently and slowly. So that's a breathing exercise you can do. Another thing that can help you is just simply being aware of the emotions that you're feeling and labeling them. So recognizing emotions as they arise. So say you're in a restaurant and you're feeling a bit hypervigilant. All you need to say is, oh, I notice I'm feeling anxious. This is a feeling that I'm feeling right now. And actually just by recognizing it, this can actually just take away the intensity of the emotion. And it's also acknowledging the emotion and not avoiding it or suppressing it. And it really helps to actually activate the brain to start to think about the emotion rather than just being in the emotion and sort of overreacting to the actual feeling of the emotion as well. Another thing you can do is just start to develop safe, supportive relationships. And this really helps a person to actually feel a sense of security and building trust in relationships. So this can be with a therapist, but it also can be with a very good supportive friends or family member who is sort of very good at helping the person feel grounded, reassured, and trusted. So if you can build a very safe, supportive relationship, this can really help a person to feel they can regulate their own emotions and again help symptoms of stress. So if you're in a supportive relationship, it can really help a person feel a sense of safety and that she can regulate themselves. So that's another thing you can do. Another thing which is quite important is your own personal boundaries. So often people with trauma haven't got a great sense of boundaries because their boundaries have often been sort of challenged, but through the trauma. So actually learning to say no, learning to say no to people or situations you don't feel safe in, can really help to actually feel a sense of control over your life. The next one is developing self-compassion and positive self-talk. And I'm very keen on this. I'm very keen on self-compassion. So it's really important that self-compassion can help you to reduce any negative feelings which often are associated with trauma. Common feelings are shame and guilt. And this can obviously make a person feel bad or go into overwhelm. So really reminding yourself that you treat yourself kindly when you actually feel distressed. So if you say when you're going to a restaurant and then you feel hypervigilant and then you feel guilty or ashamed of feeling hypervigilant, the way to say it is, it's understandable I feel this way. I've been through a lot in my life and it's okay. And that can actually help to bring down the distress. And also, it's really important to develop a sort of self-talk which encourages supportive and constructive thoughts with you as well. So say you go to the restaurant and it's been a really hard thing for you to do because you feel so, so physically on very stressed and hypervigilant. Afterwards, the idea is you say to yourself, well done. That was really hard for you to do that, but it's really good you challenged yourself and you managed to go to that restaurant and you managed to sit down and have a meal. So that's a really good thing that you've done. Another thing you can do is to get really good at routine and predictability. What often happens in trauma is, again, people are often have been shocked or surprised or felt out of control as well in their trauma. So actually getting very good at getting some daily routines, again, can create a nice sense of safety and predictability, and that can help reduce stress. Simple little things like regular sleep, meals, and self-care habits can all help to maintain an emotional balance. And another thing I'm very keen on is creating a safe environment. So finding places where you actually feel you can be feeling of safe and calmness. Hopefully that could be a bedroom that you feel is your space and you can make that your own and feel very calm and everything like that. Or maybe there could be a place outside you go, like a park or somewhere where you feel it's a very safe, calm place where you can go. And that helps to regulate your nervous system as well. The other thing you can do is physical activity or relaxation. So actually reducing the feelings of hyperarousal by releasing built up physical energy can really help. Okay, so very simple activities like going for a simple walk, yoga is very good, or swimming, anything like that. It's really good at regulating your stress levels. It's actually getting rid of all that hyperarousal and all that energy. And also you can develop relaxation skills. So a very common one is something called progressive muscle relaxation. And this simply involves going through your body and tensing each muscle each time, and then relaxing us as well. And if you try that, and again, there's an example on my handout in my website. And then another skill is called distress tolerance skill. And this comes from a therapy called dialectical behavioral therapy. And this means developing skills such as self-soothing or simple distraction techniques, getting involved in something else, a book or listening to music, and not thinking about the situation. And there's one unique intervention here from DBT, and it's called the tip technique. So actually, if you're feeling very aroused or very distressed, actually changing your temperature, maybe putting your hand in cold water as well, and then doing intense exercise, burning off all that energy, using paced breathing, getting your breathing regular, and then doing relaxation afterwards as well. So you can see you can put all those techniques together in one, and that can really help bring down any intense emotions that you feel. And then another one, which is very common in cognitive behavior therapy, is called graded exposure. But this is the most important thing, is that you hear the word graded. So you gradually expose yourself to situations, emotions that you would find distressing in a very controlled and well thought way. So again, the example of going to a restaurant and feeling hypervigilant. Maybe the first time you can't actually have a meal. Maybe the first time it's enough to go to the door, and that'd be fine, and you could come away again. The next time you might be able to go and stand in by the door and actually go into the wall and stand with your back to the wall, and that's absolutely fine, and go back. The next time, perhaps you can actually manage to sit down at this restaurant. And then maybe the fourth or fifth time you feel well enough, if you've practiced enough, you can actually sit down and have a drink or a meal. And you can hear there's a very graded and gradual response to going to a situation where you actually feel overwhelmed and feel hypervigilant. So often a therapist can help you through this, but it's something you can actually try yourself if you understand it. And it's really important that you actually try to encourage yourself to move forward, because this builds up confidence and resilience. And this is really important when you've had trauma, that you build up that sense of self, that sense of moving forward, and set yourself little goals, and actually increasing your ability to believe you can stand and tolerate all these stresses. And the last one is actually therapy in itself. And there's loads of different therapies out there for trauma. And I've just taken the two that I'm the most familiar with. And the first one is called EMDR, which stands for eye movement desensitization reprocessing, which is a very long word, I think, but it's a very well known therapy, and it really helps to process traumatic memories and reduce those emotional charges. So it's highly recommended. And then cognitive behavioral therapy helps in all different ways. As I said before, it can help with graded exposure. It can help with developing all those self-help soothing strategies such as relaxation, getting good at breathing, and actually challenge any negative thought patterns that you have as well. So that is also highly recommended. So just a key summary of the window of tolerance, because I've gone through a lot of information there. So it really is the window of tolerance. It's the range of emotional and physiological arousal where an individual can function without feeling either overwhelmed by stress, which is the fight or flight, or shutting down, which is the freeze response. And what happens with trauma? Trauma narrows this window, and it makes it harder for individuals to sort of feel in control of their emotions. So through therapy or self-help, developing this wider window of tolerance involves just learning very practical skills to help manage your emotions, increase and coping with awareness of physical sensations, and to find ways of overcoming trauma symptoms in a safe, contained way. So just a reminder of a couple of techniques. So we've got mindfulness skills, grounding, breathing exercises, using trauma therapy, developing supportive relationships, and physical activity. These can all help people to expand their window of tolerance, promoting greater emotional resilience and healing. So there you go, Ian.
Wonderful. Thank you so much for that, Wendy. Um, so finally, if someone has listened to the podcast and feels they might benefit from some form of professional help, what should they do next?
Well, on my website, wendycastellino.com, there's lots of resources around these particular ways of regulating yourself. It's sort of handbooks, meditations on deep breathing and body scan. So you can access those for free on my website. And if you're interested in therapy, you can just send me an email via that. And what about yourself, Ian? How can people get in touch with you?
Wonderful. So thank you so much for that. So uh, if people want to get in touch with Hope Therapy, we have a team of people that work with trauma of all different varieties, and offer different therapeutic approaches. So we have people that offer CBT, we have people that offer EMDR, and we have other therapeutic approaches within the team as well. People can access us via www.hopefulminds.co.uk. That's www.hopefulminds.co.uk. We have a whole variety of free resources on the website. People are very welcome to go and take a look. If people would just like to have a slightly more informal conversation with us, we offer free consultations that we can offer to people. And if people want to access the team itself, then again we can just talk about that via the website. So thank you very, very much, Wendy. It's been fascinating, and thank you so much for sharing all of your insights today. And thank you to our listeners as well for tuning in. And just to remember, if people are struggling with trauma or any other mental health challenge, then help is available. And taking that first step really can make such a difference. So thank you, Wendy, and thank you, everybody.
Thank you.